All right. Well, good morning, everyone. Thank you very much for your patience. It is Monday, June 10th, 2024. Thank you all for being here live. As I try to recall and make sure that everybody is on the same page with these meetings, we're going to go through recertification, which we're going to talk about this morning, but keep in mind that these are being recorded as well. And if you need to reference them back, they should live on our YouTube channel. So you can go out there and subscribe. That way you're notified when we have one of these meetings, just in case you miss one. So just know that. And if you need help with that, please let us know. But as we normally start, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And thank you for being here. And as I always start the meeting, we're going to start in the classroom. We've got to keep one foot in the field and the other one in the classroom at all times. So we've got some trainings this week. And let me go ahead and pull up my screen here and you guys can check that out. All right, so this week we've got quite a few things going on. Today we've got Humana doing 2 sessions on their Vantage self-service resources. So if you're interested in learning more about how to use their portal system, they've got a training at 10 and then another one at 4 o'clock. Today, United Healthcare is doing a Find and Engage Consumers. This is a marketing class at noon today. Devoted, how to set up successful events at 1 o'clock. Moving over to tomorrow, we've got Aetna Medicare 101 training. We've also got a Cigna DSNP training. Both of those are at 10 o'clock tomorrow. Also tomorrow, United Healthcare is doing VA and TRICARE for Life training at 1 o'clock. Followed later in the day, Cigna is hosting their self-guided veterans presentation as well. So veteran training is becoming more and more of a thing. Check those out. That's for tomorrow. Moving on to Wednesday, Al Clancy is actually, I believe, still on vacation. So this may not take place at 9:30. However, we've got Cigna Military Health Benefits and Medicare Advantage. That's at 10 o'clock on Wednesday. Freedom is going to teach you how to get to know your call. So this is a training class that's set up at 10:30 on Wednesday. Cigna's doing office hours at 11 on Wednesday, but we are also, so if you have any contracting questions, the contracting team is available every Wednesday from 11 to 12. Jessica will be on PTO this week, so Sam is manning the ship there. I appreciate that. Al is back, by the way. Can't wait to hear all about his vacation. So Ask Al is on for Wednesday at 9:30. Thank you, Al. Appreciate that, buddy. And then on Wednesday at 1 o'clock, we've got training breakfast with Devoted. So come on in there. There's lots of changes happening for 2025. We're going to talk more about that today. Thursday the 13th, we've got Aetna doing their dual eligible special needs training. This is at 10 o'clock. Also at 10 o'clock, Devoted doing overcoming objections. Okay, overcoming objections. Seems kind of basic, but I'll tell you what, there's a lot of things that consumers will try to stump you on. So this is a good training class to have if you've never had one. Devoted social media training, 1 o'clock on Thursday, and then followed by HQ intro that's hosted by Gabe Diaz and Al Clancy as well. This is our HQ, our headquarters for everything you need to do your business. We're going to talk about that today as well. And last but not least, Tom Ryan is hosting our What About HPM shop. Now, this training is going to get more and more intense here as we start rolling out new benefits for 2025. So if you're not already familiar with our quote and enroll tool for Medicare, please check that out. And that is Friday at 9:30. That's a training for the week. Remember, guys, one foot in the classroom, the other one in the field at all times. It doesn't matter if you've been in this business for 10 minutes or 10 years. There's always something new to learn, and we're going to talk about that as well. As I mentioned before, recertification is on the horizon. We're starting to get notifications of carriers that are going to be sending out recertifications by email. And I know how great you guys are at email. You all are at inbox zero. You answer and read every single email every single day. And I appreciate that about you, right? I know how bad you guys are with email. So what we're doing is every email that we're aware of for recertification instructions is going to live in HQ under contracting. And we will be building out a section here that will be rolling out very, very shortly called Recertification 2025. And that will house all of the information that you need to begin your recertifications as they begin rolling out. So again, everything's in HQ. You're going to go in there, you're going to see recertifications. It'll have recertification instructions for AHIP, FFM if you're doing ECA business, and then each and every carrier as they begin sending these recertification links, instructions, and everything will live in one place. So if you don't have access to HQ, please send an email to support@askhpm.com. Support, putting this in the chat for you, at askhpm.com, or you can call us on our handy dandy phone number, 844-696-3975, and we'll get you hooked up to make sure that you've got access to HQ, okay? So big news there. Just remember that that's going to be built out under contracting, under recertifications 2025. We want to make sure that you guys stay recertified because even if you have a couple of clients, it works out to be a lot of money, you know. Just as an example, let's say you have 2 clients, and for Medicare, let's say you've got 2 clients and they're going to pay you about, you know, 300 and change for each one of those clients throughout the year. And you're like, I don't want to recertify. Well, if you do the math, 2 clients at about 300 and change is almost $700. These certification classes take about, let's say on the high end, about 2 hours, okay? So is 2 hours worth $700? It is to me. Even if you don't sell another plan, at least recertifying will keep that money flowing in. So think about that. Don't let contracts go just because you have a couple of clients there. It's really good to keep that live. All right, so I want to shift gears because there's a lot of speculation, rumors, things happening in the industry that that are still kind of up in the air. And I'm shifting gears to talk more about the provider side. Now we're seeing some action taken by a lot of provider groups and a lot of doctors' offices out there. And some of them are closing offices, some of them are relieving staff, some of them are, you know, combining and merging offices or locations. Some of them are even letting doctors go. And you're probably wondering why this is happening. And this is separate in a way from the Medicare guidelines that were released earlier this year. This is separate in a way. This is just talking about the provider groups. And the reason this is happening is CMS is implementing a new coding system called V28, okay? So I found this really amazing chart here. It's an infographic that I'll go ahead and put in the chat for you guys. If you want to download that, you can. This was put out by Innovista Health, and this talks about the transition from ICD-10 and V24 into V28. So I'm going to go ahead and read it to you, and then we'll digest it a little bit along the way. So Medicare Advantage ACC model V28, what does it mean for providers? The Centers for Medicare and Medicaid Services, CMS, recently finalized policy updates for Medicare Advantage plans, which include changes to the MA capitation rate and risk adjustment methodologies. These changes will impact risk adjustment factors, or RAF scores, hierarchical changes categories, or condition categories, HCCs, and how health plans and medical practices manage patient risk and allocate resources. This new HCC model, version 28 or V28, will phase out the V24 model that has been used since 2020. V28 will be phased in over 3 years in 2024 and 2025. There will be blends to varying degrees of V24 and V28 before V28 fully takes effect in 2026. So as this chart's showing, this year, the providers must implement 33% of their coding for V28, and they can keep their V24 67%. Next year, they have to ramp it. They need to be using 67% of their coding and methodology on V28, with only 33% on the old model. And then in 2026, V28 must be fully implemented. Some other key developments include rate increases for non-end stage renal disease, which is why you're seeing companies like Gold Kidney. 2 new quality measures, depression screening / follow-up and adult immunization status will be added in 2026, with 2024 data being used for inclusion and star ratings. So they're going back about 2 years. Why did CMS make these changes? CMS reviewed conditions where significant coding variations existed between MA and Medicare fee-for-service. The agency eliminated HCC's, hierarchical condition categories. If conditions did not accurately predict costs, coefficients were small, conditions they represent are uncommon, conditions did not have well-specified diagnostic coding criteria. What are the most impactful HCC changes in V28? Renumbering of HCC categories, an increase in HCC categories from 86 to 115, but the removal of 2,294 ICD-10 CM codes that will no longer map to an HCC. Some of these categories most affected by this include cardiovascular, metabolic, neurological, psychiatric, and musculoskeletal. Addition of 268 new diagnostic codes will be mapped to HCCs. Now, this is important because essentially there will be no more upcoding. They eliminated almost over 2,000 codes, which is why these providers are tightening their belt. Of note, CMS used a process called constraining in V28, in which related HCCs are given the same coefficient assigned weight. The diabetes and congestive heart failure disease categories are most impacted. For example, with V28, RAF score will not change with type 2 diabetes, regardless of whether the patient has diabetes with or without complications. Okay? What changes can you expect with RAF scores? Prior to applying coding intensity and normalization factors, the proposed V28 model is resulting in a RAF decrease in the range of 7 to 22% with an average of 13. After applying the updated fee-for-service normalization factor, the RAF impact of the proposed V28 model is +2 to -14% with an average of -4%. How should you move forward? As the CMS HCC risk adjustment model continues to change, it's important to stay up to date on requirements. This will ensure your organization can continue to provide quality patient care and receive the necessary financial resources to do so. Again, this is talking to providers specifically. So big changes ahead for how doctors make money from CMS, from Medicare Advantage. That is why you're seeing the changes happening the way that you're seeing the changes happen, okay? Will posted, coding is changing. Have they considered the cost of retraining the coding staff? This is a significant expense to providers. This is a great point, Will. In fact, if a provider is not using an EMR system, they're dead in the water, because since ICD-10, it was so complicated. When they're coding now, most of the software is guiding these doctors on how to use this new model. So it's a great point, but as long as they're using an EMR, an electronics medical record, they should be good to go, and they should be able to manage and navigate these changes as they occur. So I know that might be a little heavy for a Monday morning, but if you want more information on that, you can reach out to me or the team, and we're happy to discuss more. And again, if you have any topics that you'd like to hear on these calls, please let us know. Now with that, I have a special guest on the line. I have Jessica Vitalo from Elevance, and she is here to give us the good, the bad, and the better of Elevance. So Jessica, do we have you here? Hi, Jessica.
Hi, I'm here. Sorry, I couldn't unmute for some reason.
All good. Thanks for being here. We appreciate it.
No problem. I actually just wanted to, is it okay that I share my screen?
Absolutely. Absolutely. Yeah. A quick intro just to make sure everybody knows who you are. And I see you're on
Not
the
a
road.
problem.
So Please be careful.
I'm pulled over on the side of the road, as you see, because
Awesome.
I don't want to be late for my next meeting. But my name is Jessica Vitale. I'm with Elevance. For those of you who don't know, Elevance is Freedom Health, Optimum Healthcare, Simply Healthcare, and Health Sun, which is our Miami Syndicate South Florida health plan. So we have 4 health plans in the state of Florida that are Medicare Advantage plans. We are MA only, although I will tell you and give you a beautiful sneak peek that, it's the worst kept secret in healthcare, we will have an ACA plan for next year that will go under Simply Healthcare. We don't know what it's called yet, but that with the new CMS rules, we are needing to make sure that we do have an ACA. So there will be an ACA plan associated with Elevance for the first time in the state of Florida. So that's a really big deal. It kind of creates that beautiful triangle of Medicare Advantage, that beautiful D-SNP plan, and anyone especially under 65 with D-SNP plan, and then the ACA plan. So there's everybody in that one house we can cover under the Elevance brand. So it was really important that we get that done. And we got absolute 100% confirmation of that last week. So we're really excited about that. And then I'm basically here to just remind you all that we are still here. And
love it.
we are not going anywhere. Let me just figure out, because I'm so sorry. This is the first time I'm ever using Green Central, so I do apologize.
Oh, yeah. No problem. It's down at the bottom. You should see like a TV with an arrow up that says share.
Thank you. Window. Sure. I'm just going to go for my screen and figure it out from there, I guess.
Yeah, you got it.
Your entire screen. Sure. And then you guys just let me know exactly what you can see and what you can't see.
Yep, we could see your deck.
Awesome. I'm going to slide through this rather quickly. I wanted to talk today mostly about our C-SNP. Our C-SNP is the best in the entire country. If you've sold it, then you know it is very difficult to get someone to leave our C-SNP plan unless they move out of coverage area or they simply pass away. I don't say that to be funny, although it is kind of funny. However, it's just the truth. Our C-SNP plan is the best in the business. Freedom and Optimum created the C-SNP plan. They basically taught everybody else how to do it. And even though the other carriers try, it really can't be duplicated. So that is the biggest thing that we have to offer you guys right now before our new plans come out. I want to just talk to you about 38% of brokers in 2024 have sold C-SNP plans, which is a lot. That's a lot. There over 10,000 have been sold. That's cracking like the surface of what can actually be sold. Most of these people we're finding aren't even on the right plan for them because, as we know, a lot of them sign up by themselves because they think they're very tech savvy, which they are, but they don't understand all of the wonderful things that are promised to them. Now that's where you guys come in as amazing brokers. You can actually help them out and get them to not go online and get them to use your amazing Pearl, your personal URL, if you have one for whatever you guys use. I think you guys use Connecture over here. So I don't want to bore you. You guys know why C-SNP is important. And I want you to make sure that did I give you the wrong slide deck? I did. Those are my additional C-SNP. Of course. Let me get the right one. Where is it? Chronic training. No. Oh my goodness. What is happening? I will find it. Do not fear.
No worries. While you're doing that, we were discussing this morning about the impact of those with diabetes on a chronic plan because of the V28 changes. And I know you guys are impacted by those changes and how the providers are billing you. Can you talk a little bit about, what you guys are seeing in the forecast for 2025?
We're not going to have too many things that change with our plan per se. There's going to be a lot of changes formulary wise that they're really going to have to figure out. We haven't been told. We had a meeting last week, to be really transparent, that they basically said, hey, listen, a lot of the country is going to change. Florida is not going to be one of those things for us. They're not going to mess a good thing up. They're going to pretty much keep everything status quo. The only thing that really might change is really on the end of figuring out exactly how the formulary fixes are going to happen, and coding wise, what they're going to do at the provider side, like that you were talking about earlier. We're working with a lot of our providers right now. As you all have seen such a crazy change, even in the last 2 weeks with some of these provider groups, right? Of leaving and not exactly being as solvent as we all thought they were going to be. But as all the doctor groups tighten up and figure out exactly what their coding changes are going to be, we haven't seen such a drastic thing because we didn't change our plans as drastic as all the other carriers. So we're not going to see as big of a deal. You're going to see a lot more a lot more mix up with a lot of the bigger DSNP values. So you're going to see the DSNP plans change immensely. They're going to come back down to a reality monetary level. And you're going to see our CSNP come up a little bit with auxiliary benefits and not too much change, which is something that we offer. And of course, I'm not looking for the document while I'm talking to you, because heaven forbid I do two things at once. But
it's all good.
The thing that Freedom and Optimum offers, and Elevance for that matter, is we don't change the plan names. We don't change the plan numbers. We get better and better every year. We add a little bit every year to get better. The thing that I think is going to play a huge part in especially people shopping for next year is going to be that people are going to be angry that certain carriers are changing yet again, and you're going to have to track down your old book of business and get them on a correct plan. And when they're angry, that's a great time to present, hey guys, this plan this carrier has not changed. They just keep getting better and better little by little. They don't make these huge swings in the market. They just go and they're steady, and we're not going anywhere. We're not cutting anything, as you can see from all of the wonderful news that's been out in the last 3 weeks. There's not cuts being made. The only thing that we really made changes to is our dental, which we changed our whole dental network for next year, and then that's just going to be tightened up. And we're adding the ACA, and we're making sure we did get Simply will be the Medicaid contract for the next 3 years. So they did win that too. So I don't know if you guys knew that.
Yeah, that's phenomenal. You brought something up, Jessica, that was really, really important on what we see in the market. You mentioned, these plans are coming out with new plans, and then you have to change your book of business. And I want to explain to the agents why this is happening. Okay. And I think this is a bad game that I hope CMS catches on. These carriers, these carriers are getting themselves into hot water by not managing the business properly. So their star ratings go down. And so what they do, instead of fixing the plan, is they come up with a new one, because the star rating, when they first apply for the plan, is actually at a 4-star payment level. So if they slip under 4 stars, if they go to like 3.5 stars, then that could mean hundreds, if not millions of dollars in business that they lose just because of a star rating. In fact, on the opposite side of the fence, we just read there's a health plan in California called Scan Health Plan, and they did their own internal audit and found that CMS was underscoring them on their star ratings, and they won billions of dollars back from CMS. So the point is that CMS doesn't always get it right. And CMS is not watching the hen house properly. And so, to Jessica's point, are you putting your business with a plan that ultimately is playing this shell game of moving business around? Because they don't care about us, guys. All they care about is profitability and keeping their shareholders happy. And meanwhile, Elevance is already at the top. They're doing the right thing. You've got Freedom and Optimum that have been solid plans. So why play into the shell game? Pick a product that you're not going to have to go back and switch again in 12 months or 24 months. So just wanted to say that.
Yeah, and I appreciate that. And, I've been saying it for a couple years, especially last year after, half of AEP, most of you were spent tracking down your old book of business. They do it so that you don't need to see a shiny new object there. It's very much like the look over here instead of the people that have been here all the time. There's a reason that, we've been in this business for a long time, and there's a reason that the star rating for Optimum is in its, oh my gosh, are we in our fourth year in a row?
Yep.
Health Sun is in their 7th year in a row. Simply for the first time got 5 stars since Elevance bought the brand, which we all know it was suffering, and then Elevance bought it and has really turned a lot of it around. Excuse me while I wet my whistle. It is so important, and I know not all of our plans are for everybody, and that's fine. But when you want somebody to stay with you, I think it's really hard, especially this coming year, when you're going to have people that are going to say, well, you did this to me last year.
Right.
Well, what's that about? And then they start questioning your integrity, and they start questioning what you have to offer. And that's not fair to you as an agent, which you're doing your due diligence. You're telling them, hey, this has changed. You don't write the plans. You're presenting the best plan for them. So I just ask that you take a really good look at our plans that we have to offer. I think we're going to have a really comparable and comparable DSNP for next year. For those of you who love the DSNP, our CSNP is always number 1. We'll have that ACA. And excuse me, I apologize. I'm like the 2nd week of my crud. And I think something that you guys, I really want to hammer home is that the CSNP, you can sell all year round. You don't need a special 5-star. And I think there's confusion with that. I did a couple trainings in the last 2 weeks. Oh, excuse me. I'm going to cough one more time.
It's going around. I can tell you that.
Oh my God. So sorry. So I did a couple trainings where people really thought you had to have 5 stars to do CSNP. Chronic Special Needs Plan is what CSNP stands for, right? So that can be at any time. Say somebody all of a sudden is diabetic. Like, think about that. I wasn't diabetic yesterday, but something happens to my environmental changes or, physical changes, and I become a diabetic. I can't wait just because of a 5-star plan. I have to make sure that I have it all the time. So those beautiful things are what happens and allows us to sell our chronic all year round. And that's any season, by the way.
Yeah, let me give you a breather there too.
Thanks.
So yeah, you got it. So on the CSNP side, guys, it's once a year that they can change to a CSNP product. Okay, so just like 5-star, they get 1 extra enrollment opportunity. Now, it's important because sometimes we skip over this. If you write them on a CSNP and use the CSNP designation for January 1st effective, you can't use it again for 2025. So for 1/1s, make sure you're using AEP as the election period, or use some other election period after December 7th. So you're not burning their CSNP designation. You can use the 5-star, and then if they make a boo-boo and go with an inferior plan and want to come back, then you can use the CSNP, or vice versa. You have 2 election periods at your disposal. So great point. I'm glad that you brought that up.
Yeah, and I also want to bring up, before I get through this CSNP thing, for people who are so insistent on having dentures, even though they don't, or they're like, what if I get them? I guess we turn 65 and automatically we freak out that tomorrow we're going to need dentures, right? I don't know what that magical button is, but I guess it's the same magical button that turns us into our parents when we turn 40. I don't know. Whatever that may be, really, I want you to take a look at, I don't have it with me right now to present to you, but I just want you to look at the Simply Dental. Simply Dental has the best dental program in the MA market. The additional thing is that they get it right away. You get your dental done right away. It's not a 6-month waiting period. It's not 3 months. If they need something now, get them on Simply, put them on Simply, and then switch them to a chronic after, or another plan that they can qualify for that maybe has a richer benefit after they get their dental work done. Simply is the best dental benefit. And this is for any plan. There's no way for me to tell if John Smith got his dentures with CarePlus last year, but now I'm switching him to Aetna. There's no way for Aetna to tell that he got his dentures with CarePlus. There's no way for Optimum to tell that he got his dentures with Aetna. So please keep that in mind for people that are like, oh, well, I'm only on, I really need a new pair because I lost it or I moved or I'm living in a van down by the river. But carriers, we can't keep track of other carriers and when they got their dentures. So just always keep that in mind too. It's a really good snippet to just know we can't track that. Other carriers will tell you we can. That's not true. We can't track it. So don't let that prohibit you from switching them for a denture reason. So there are many reasons you can get a chronic condition: heart failure, chronic kidney disease, hypertension, arthritis, depression. Depression doesn't qualify you by itself. So just keep that in mind. And Alzheimer's, this is something that is huge. There are over 1,054 codes that you have to put that qualify for the CSNP. Now, there's only one code in that person's file that needs to be one of these codes all year round that will qualify you. You don't need to write it every single time. This is why the doctor groups have their own coded EMR team that do, HEDIS and all that good stuff. Very quickly, these are our two big plans in the Tampa Bay area, the 028 and the 029 for our CSNP. You'll notice that they are identical. The only thing is if you have a client that is on oxygen, they have to be on the 029. Oxygen is absolutely free on the 029. It is for our COPD patients. If your client is not on oxygen, has diabetes, and maybe asthma like I do, put them on the 028. They'll get all of their diabetic medication, including tier 5s are $10 through the donut hole, which you'll see on that RX cost share on the bottom there, second column from the top. And the most important thing to remember is that they get a full give back with this plan. Their maximum out of pocket is rather low. Inpatient hospital, they'll get $65 for days 1 through 5. The reason there's nothing after that is because it's zero. It's zero after days 5, which is pretty darn great. Some other big things to keep in mind is that they get $75 a month in OTC. They get $85 on their everyday allowance, which includes pet care supplies, utilities, home care, and groceries. It used to only be the good for you groceries. Now it's all of the groceries. We include Publix, Walmart, Winn-Dixie, Save-A-Lot. We include Fresco y Mas. There's over 500 different facilities that we use now that uses our card. Pet care supplies, you cannot use it at Petco or the other pet place, which I forget what it's called, but you can use it on Chewy.com, which I found interesting. Utilities, all the utility companies throughout the state of Florida, and any home needs, including any kind of extermination stuff for bugs or fleas or for cockroaches, anything like that, that's allowable, as well as beauty supplies, which is important for the ladies and the gentlemen to keep their hygiene very nice. $500 a year active fitness. What does that mean? For right now, it means golf, tennis, and swimming. Any of those facilities, if pickleball is presented at those facilities, then yes, it is covered. It is how that certain facility skews their card. Every facility is not created equal. They're all different. I have many clients that say, hey, we're allowed to use this at the pro shop. Awesome. Good for you. Go tell all your friends, sign them all up. But unfortunately, it's not everywhere is like that. It just depends on the club. It depends on the range. Remember, you can't use it at Topgolf because Topgolf has a bar, which is why you can't use it at bowling alleys. Next year, there are going to be a lot of changes to the active fitness card, as you saw with the Aetna changes in the middle of the year, with the no longer having the sneakers or walking poles or the national park thing. So I think they're going to kind of crack down and be a little bit more crazy about exactly what the fitness card is. I don't necessarily agree with that. We want active people. We want compliant members. We want people to stay healthy and get better and change their circumstances. So that kind of bothers me a little, but that's just me personally. Is there any questions for those?
There was a question in the chat. Is Ozempic? Do you know if Ozempic is a tier
So
5?
no, Ozempic won't be covered on tier 1.
Good.
It's going to remain tier 5. I don't think it right now. We haven't gotten an update. I don't see it changing because of the weight loss ramifications that people are taking that aren't diabetic. I do encourage those people to go ask their doctor about semaglutide, which is the generic form. Semaglutide, SEM, I believe it's I, and then GLUTIDE. That is the generic form of Ozempic, and it's a lot cheaper. It helps a lot more. And I just, because of how much it's taken off, where you can go to any like IV place and get it now, they're not going to put that under tier 1 anytime soon. If they do, please, I'll buy you a drink because I'll be so surprised. This plan that you're looking at now isn't very popular. We introduced it last year only because if you look at it, yes, you do not get a Part B rebate, but the max out of pocket is $1,000. And then look, PCP and specialist is $0. And inpatient hospital is $0 for days 1 through 90. It's a very good plan. We don't have many people on it. It's a very good plan. And you will see that that is for somebody.
That's gonna be for somebody that has multiple specialists and is at high risk for going to the hospital often. So because look, if they're on the give back plan, they're gonna burn out their give back if they're spending all their money with copays. So I mean, do what's right for your members. You know, do the math for them is what I'm saying. It's because they're thinking they're getting money back, and at the end of the day, they're actually losing money because they're on a plan with copays.
Yeah, and they're going to be in the hospital all the time. So this does cater to a certain individual that we really wanted to. It started last year. This plan isn't going to go anywhere because it does cater to that individual. And if you have that relationship with your doctors, use that and say, listen, do you guys have those high flyer patients where every Friday you call them and say, hey, don't go to the hospital. Remember to call us. Let's talk to them. Look at this. I have a plan that can really help both of your needs. This is a great plan for those people, like butter. They still get the $85 for a monthly allowance. They get $85 over the counter. So everything is the same with the exception of that first screen. It's like zeros down the board and $1,000. I would kind of like this. I'd be like, here's $1,000. I'm going to go to the doctor whenever I want. And especially if someone loves their specialist and wants to go see them all the time because they saved them 15 years ago, this is a great plan for them as well. Those are our 3 biggest CSNP plans. Those are our only CSNP plans. They're not changing. They will get a little bit richer, you'll see, but nothing is going to go down. That's what Optimum is kind of famous for. The best thing about this is just the benefits prepaid card. It works like a MasterCard. We went over this. It takes care of all this really great stuff. Utilities, active fitness. This is a little bit hard to read, but this is the insulin on the formularies. You guys, something else that I really want you to remember, not all formularies are created equal. My formulary for Optimum is different than my formulary for Simply, which is different than HealthSun, which is different than Care Plus, which is different than Humana. Their tier 1s might be our tier 2s. Their tier 2s might be our tier 1s. I wish that weren't so. I think that that's so ridiculous. It should be one darn formulary to rule them all, but whatever. That's just the world we're living in. So just remember that not everybody's formulary is the same. Our formulary is very easy to look up. You guys are really good at it. We switched to Carelon RX this last year. It's been really, really great. If they have their own, that's wonderful. But if they need to use ours, that's cool. You get your 2 copays for 3 months, just like anybody else really does. It's very simple. This is just to make sure that you guys, for right now, now until October 15th, we are still offering the HRA bonuses. If you didn't know about this, just listen up because this has money and you guys want money. I want money. You want money. The CSNP for Freedom and Optimum for their HRA, you get a $125 HRA bonus. The D-SNP for Simply and Freedom and Optimum, you get a $125 bonus. All of the other plans, all the core plans across the board are only $50 for the HRA. It's still something, but right now, while we still can, and while you guys can still make money before all of the craziness changes, do it. It's very easy. If you have a hard time asking those questions, think of it as like a, oh my God, I always say like when I'm talking to someone, I say, listen, this is just like how every 10 years the government takes the census. This is so that we can gauge what's going on with the population. Is, how is our mental health? How is our intake? We're obviously, when we don't have a lot of money, what are we going to do? We're going to drink more. We're going to be sadder. That happens. So some of the questions are a little invasive. If you've ever done them, that, especially if it's your first one, you're like, oh my gosh, this is terrible. But you're getting $125. It's really easy. It's like 12 questions, get it out of the way. That is huge, especially now while we still can, because that will no longer be offered as for the October time. And that's really it for as far as that's concerned.
Yeah, there was one question in the chat that was specific. Does the Diamond Reward also have the $85 for the shopping and active health benefit? Did you recall seeing that?
So our Diamond Reward is the yes. So the $85 is because the Diamond Rewards is our C-SNP plan. Okay. So yeah, they all get the $85.
And by the way, I know that you guys are in different pockets all over Florida. So if you're not selling in the Tampa market, if you're in Orlando or South Florida or Jacksonville, which is where Simply entered a couple years ago, we're happy to share those benefits with you. Just, shoot us a note and we'll connect you with the managers in those areas so you can kind of go through it.
And remember Tampa, Pasco, Hernando, Pinellas, and those are pretty much it. And a little bit in Citrus. That's going to be your core optimum. When you go to Orange, Manatee, Sarasota, anything over that way in the middle, Polk, you're going with Freedom. They have the exact same benefits. It's only under Freedom and it's under a different number. So it's exactly the same across the board. They're just called Freedom. That's just how it works. I could go into a huge thing and explain to you exactly how it happened, but no one wants that. It's Monday morning and I would like to give you some time back.
Yeah. No, that's perfect. Yeah, it's Freedom Country in Central Florida. We know that for a long time. So, Jessica, you've been extremely helpful and knowledgeable with this. Thank you very much for your conversation and your deck. We really appreciate that. Jessica's phone number is in the chat. You have it there. If you have a pen, 813-564-5665, or you can email her at jvitalo@freedomh.com. It's in the chat there as well. Jessica, you've been fantastic. Thank you for taking time out of your busy day to chat with our team and make us smarter. We appreciate that.
Thank you for having me. And guys, like, even if I'm telling you, I have agents that text me all the time with random stuff. Some of them are some of your people that I will answer right away. Text is always easier because if I'm on the road or if I'm in the middle of a meeting, I can make sure that I just get it to you while I'm pretending to be in a meeting. So that's just, it's easy for me to get to you that way. There's no stupid question. Guys, things are changing every day in this industry. This is just another hump we have to get over. Remember when, some of you will remember when we stopped with the paper apps and we said, you got to do a lot of digital now, and people freaked out. And now people are like, when digital goes down, they freak out. They got to go back to paper. It's just another thing we have to get over. I just want to stress that we're always going to be here for you. We have not downgraded our team. We've only upgraded. We're continuously making sure that we are at the best of our game so that we can be here for our broker community. We know that you guys are what gets it done. And we're excited for the next coming year. I think it's going to level out and some cream will rise to the top. And we happen to think that we'll be one of those guys. So we're appreciative of you guys.
Absolutely. Thank you, Jessica. We really appreciate you. And,
thank you so much.
Please. Yeah,
thank
you got it.
Have a great day, guys.
You too. All right, everyone, that's it for us for this episode. Remember, we'll do this again, same time, same station next Monday, and we will continue to rock and roll. So It's the middle of June. Recertifications are going to start rolling out here soon. So prep, get out there, talk to your members, and get smarter because they need you to be smarter. All right. Hope everyone has a fantastic, productive week.